Welcome to the Social Consequences of Pain. We're glad you're here. My name is Angie Hunt, Project Manager with the Canadian Institute for the Relief of Pain and Disability, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC Government, as well as donations and memberships to CIRPD. We thank our program partners, Pain BC, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You will be emailed the direct links for all of these items when they are available. As I mentioned, my name is Angie and I'll be moderating the webinar and Q&A session. Our presenter today is Dr. Claire Ashton-James. Dr. Claire Ashton-James is the Senior Lecturer at the University of Sydney's Pain Management Research Institute. She's completed her PhD in social psychology and obtained international research and teaching experience as an assistant professor at Duke University, the University of British Columbia, the VU University in Amsterdam, VU Medical Center Amsterdam, and University College in London. Drawing upon her broad expertise in social psychology, Dr. Ashton-James' research reveals the impact of a person's experience and expression of pain on their interpersonal functioning and relationship outcomes. And now I'll hand it over to Claire.
Hi everyone, I'm Claire Ashton-James and I'm really happy to be able to talk to you today about the social consequences of pain. Specifically, I'll be focusing on the social consequences of chronic pain. And as I'll be talking to you, you'll realise that they may be quite different to the social consequences of acute pain. So just to get started, I just want you to think about, if you know anyone who has chronic pain, or if you yourself have chronic pain, to ask yourself, what is the most distressing part of having chronic pain? Many of us can imagine that it would be living with a constant fear of pain or the experience of acute physical pain or persistent pain. But in fact, many people with chronic pain report that the most distressing part of having chronic pain is the social isolation. In this study done nearly 10 years ago by Dennis Turk, this slide's a little bit fuzzy, but he demonstrates that the social consequences of pain are actually as important for patients as many of the physical and psychological consequences of pain. Here in this table, you'll see that participants or patients in this study were asked to rate out of 10 how important each of these particular areas of their lives were to them and how important they were as an outcome of their pain management treatment. And sex life, taking care of family, children, spouses, parents and other relatives, relations with family, relatives or significant others, relations with friends, employment, participating in family activities, participating in recreational and social activities were all rated just as highly as things that are commonly associated with distress and chronic pain, such as emotional well-being, fatigue, weakness, difficulty concentrating and remembering things. So those social outcomes are just as important to people as the psychological and biological and physical outcomes of pain management treatment. And yet what we see is that social outcomes of chronic pain are very rarely treated in multidisciplinary pain programs. They're very rarely addressed. Just to further emphasise the importance of the social consequences of pain for the experience of chronic pain, Sturgeon and his colleagues recently published a fascinating article with thousands of people using this collaborative health outcomes information registry that they have in the United States. And they were able to use this massive data set to see what factors actually predicted distress, depression and anger in chronic pain. Was it physical functioning? Was it disability? Was it pain intensity? Or was it satisfaction with social roles and satisfactions with one's social life? And they found that the most salient factor in determining pain-related emotional distress was the disruption of social relationships rather than global physical impairment. This is a really important finding. Here in this table you'll see their results. I've circled these two correlations just to this is the correlation between social satisfaction and people's anger and depression. And you'll see that these correlations are higher than correlations between physical function and between pain intensity and anger and depression. Just highlighting the fact that there's really a very close relationship between the consequences of chronic pain for one's social life and the distress associated with chronic pain. Here again, this just to emphasize the point further, we see this is taken directly from Sturgeon's paper. We see he finds using complicated statistical modelling that pain intensity was related to physical function or disability, which in turn was associated with satisfaction with social roles. So we see that the extent to which people can move around and do activities in social life is affecting their ability to fulfill their social roles and their satisfaction with social roles. And it's the satisfaction with social roles, or their ability to function socially, that in turn is influencing their depression and their anger. So chronic pain has this satisfaction with social roles and satisfaction with social life contributes to chronic pain distress. And so this is why it's really important for us to understand and manage the social consequences of an individual's pain, because these social consequences in turn are contributing to pain and distress experienced by patients with chronic pain. So it's a reciprocal relationship between chronic pain, social outcomes, and chronic pain. So in today's presentation, I'm going to outline the multiple social consequences of chronic pain. I'll be looking at why chronic pain challenges social relationships in the ways that it does. We'll talk briefly about some clinical implications. It's a very new area with relatively few randomised controlled trials of social interventions, and then we'll have time for questions. So a recent article published by another social psychologist who's also Australian, Brock Bastian, he outlines and does a systematic review to outline the positive consequences of pain. And one of the sections in this review is a section on the positive social consequences of pain. Now, it's important to note that in Bastian's review, they review only the social consequences of acute pain and highlight the fact that when people show pain expressions, it can induce empathy from others and elicit help from others. And so you see a lot of affiliation and care in response to the communication of pain. And that's a positive social consequence of acute pain. However, you'll notice that when people have chronic pain, you don't see quite as many people getting flowers and help and phone calls for persistent pain. When it's in the acute phase, it will stimulate people to help, and it will perhaps even strengthen interpersonal relationships. But in the case of chronic pain, we see that this might not be the case at all. It might be more of a negative effect on social relationships. But let's look at these in turn, because it's actually not as simple as it might seem. We're going to just review the evidence for the social consequences of chronic pain in terms of peer relationships, work relationships, spousal relationships, and parent-child relationships. Perhaps the most well-documented impact of chronic pain on social relationships has to do with peer relationships. And this is an overwhelmingly negative picture. So difficulties with peer relationships is the most well-documented social ramification of pain. Compared to healthy adults, people with chronic pain, adults with chronic pain, have fewer friends or reciprocal relationships and report lower social support. Children with chronic pain are 3.3 times more likely to face conflict with friends, 2 times more likely to play alone, 2.5 times or 2.6 times more likely to be victimised compared to normative data on children, and qualitative studies of friendships in adolescents show a similar picture, with chronic pain reflecting themes of sadness, social exclusion and anger. And so it appears that when it comes to peer relationships, chronic pain has quite a detrimental effect on those social connections. In the realm of work relationships, it's not the absenteeism from work does not appear to make the hearts of co-workers grow fonder. And this is especially the case when there's a compensation claim or when co-workers need to take on extra responsibilities due to the absence of a worker with chronic pain. Workers with compensable injuries in qualitative research report experiencing suspicion and mistrust in the workplace, and they experience job threat or job insecurity as a result of damaged co-worker and employer relations. Much of this research is qualitative and it's giving us a rich picture of people's perception or subjective experience of rejection in the workplace after taking time off for having a persistent pain associated with a compensable injury. Now, in quantitative research, there's some fascinating experimental research showing that actually these perceptions or subjective evaluations of being rejected in the workplace may actually be quite accurate. So Martel, Weidman and Sullivan, Canadian researchers from, I think, McGill, showed that when participants viewed videos of workers lifting boxes and doing a labour type role, and when they showed pain behaviour like holding their back or rubbing their arm, people who watched these videos perceived these workers as lazy and unreliable. And so they knew nothing more about these people other than that they were showing some pain behaviour. But compared to the people who viewed videos of workers doing the same task without showing pain behaviour, they were perceived as less likeable, less reliable, less dependable and less ready to come back to work and less competent. And so that's a demonstrated difference in the way that workers might be perceived when they show pain behaviour compared to those who don't. Now, importantly, there's no necessary difference in the actual performance of the workers who are lifting these boxes. They might all lift the same number of boxes in the same amount of time, but they're perceived differently because of their pain behaviour. And so this conclusion is also reflected in earlier research by Chibnall and colleagues, showing that pain expressions may be interpreted by people as a sign of disability, regardless of actual functioning. And so just showing signs of chronic pain may be a social signal that people are using to interpret someone's personal traits, character or competence. Now, importantly, this is a very important study by Byrne and Hochwater, who found that chronic pain is actually only associated with lower workplace performance when it's accompanied by low perceived organisational support. And so we may be using co-workers may be using pain behaviour as a sign of disability, and that it's not necessarily related to actual performance. Actual performance isn't related to pain behaviour or even pain intensity. Actual performance at work is related to to the amount of perceived organisational support that the worker receives. So this is a really fascinating research and really important that we understand that chronic pain in and of itself isn't necessarily going to cause lower performance in workers and not even necessarily lower absenteeism. What is going to directly affect performance and absenteeism is the way that we treat people who have chronic pain at work. The impact of chronic pain on spousal relationships is really quite complex. As you can imagine, spousal relationships generally are complex, and it's not as straightforward as it might seem, as you might assume. When we just look at the detrimental evidence for the detrimental impact of chronic pain on spousal relationships, we find that there's actually not very much hard evidence for a detrimental impact. However, we can speculate that it should be detrimental based on the fact that chronic pain is associated with a number of demonstrated risk factors. For example, chronic pain can induce financial insecurity and strain. Unemployment is associated with some marital dissatisfaction and conflict or marital distress. Sexual dysfunction can often be a result of chronic pain, and that is also demonstrated, evidence shows that sexual dysfunction is a risk factor for marital satisfaction. Mood alterations and depression is a risk factor for marital satisfaction, spousal support, and altered social roles and responsibilities. As you can imagine, when you enter into a relationship with someone who has a certain social identity, a certain social role, a certain social standing and prestige, perhaps a certain job, has a certain physique, has a certain upbeat attitude towards life, and then if all of that changes, you end up with a spouse who's a changed person in many respects. And so all of this would suggest that chronic pain would have a detrimental impact on spousal relationships. Now, however, on the other hand, people with chronic pain are more likely to stay married than healthy couples. And 50% of couples actually report that the crisis of chronic pain strengthened their relationship with their partner, and only 20% reported a weakening of the relationship. So couples don't always respond to the adversity of chronic pain by breaking apart. Sometimes these crises can bring people together. And Cano and Williams explained these sort of counterintuitive findings by looking to literature on emotional disclosure and relationship satisfaction. And if you think about pain communication as a communication of one's emotion or one's distress or one's vulnerability, then having chronic pain, having a partner with chronic pain may force them to be vulnerable and to disclose emotions that they may otherwise not have done. And it may increase interdependence on one's partner, which facilitates emotional closeness and commitment. So chronic pain per se isn't great for relationships, but emotional disclosure, it is good for relationships. So is interdependence, and it facilitates emotional closeness. And the more that we rely on our partners, the more commitment we experience. And so it kind of stops people from growing apart, which is often why spousal relationships fall apart in the first place, is that people do tend to start to live independent lives, and their marital satisfaction dissipates as they become more and more independent. Chronic pain may be stopping that from happening. It seems to also give it also offers partners an opportunity to help and to be involved in a partner's life. It can improve their feeling of esteem, their feeling of importance and usefulness in a relationship, which they may have lost for other reasons. So it's clearly mixed with regards to, well, it's not, the jury's out with regards to spousal relationships and chronic pain. It's a very complex phenomenon, and it may depend very much on the couple, the individual couple in question. Parent-child relationships may also be equally complex and quite often have, and may also have a mixed effect. So this is a recent paper, Kristen Higgins, again Canadian research, wonderful research from Dalhousie University. Kristen Higgins and colleagues conducted a systematic review of the impact of parental chronic pain on offspring's mental health, physical health, and also family functioning. Now, the main findings that they report are that while in general offspring of parents with chronic pain report a greater incidence of pain complaints, poorer physical and psychological functioning, and worse family functioning than offspring of parents without chronic pain, so that's all bad. However, they also note that the offspring of parents with chronic pain also view having a parent with chronic pain as an opportunity for social and emotional development. In qualitative research, offspring of parents with chronic pain have commented that, yeah, sure, it's quite hard and at times it's lonely. However, I was able to have increased independence, and they also note that they feel that they had a more opportunity to learn about empathy and perspective taking for people with chronic diseases. Another couple of things to note in this area of research is that when you ask offspring, how they feel about their family functioning, you're asking for a subjective report. And these subjective reports from offspring don't necessarily reflect how observers see the family. So there are no studies that I'm aware of where third-party observers compare the family functioning of offspring of families with chronic pain versus families without chronic pain. And that kind of research would need to be done in order for us to get an objective picture of whether or not there are real differences. Because as you can imagine, children with parents of chronic pain, they know that their parents have chronic pain. They might assume that that makes them worse off. They don't necessarily know what other families look like in reality behind closed doors. And so they subjectively report that, yeah, that their family functioning might not be very healthy, but it may actually be quite normal. So it's hard to know with the available research. Earlier research by Evans, Keenan and Shipton highlighted that a critical factor in the outcomes for offspring is actually maternal physical functioning. So whether or not the mother can engage in activities of daily life rather than her pain per se. And so that was just an interesting finding, that it's not necessarily chronic pain per se that's detrimental for family functioning or child well-being, but it's disability that's associated with the chronic pain. So in summary, the evidence is clear that chronic pain has a detrimental impact on peer relationships and work relationships. The evidence is mixed with regards to the impact of chronic pain on family functioning and spousal relationships. It appears to depend both on the coping skills of the individual living with pain, as well as the coping skills of the family and partner. But overall, social relationships appear to be challenged by chronic pain in a number of ways. I found this quote from The Princess in the Tower. It's a blog written by a woman with chronic pain where she charts her journey and the challenges that she faces living with chronic pain. I found this post of hers and I thought it really expressed exactly what I'm looking at with regards to the social consequences of pain and the reason why it's so important to understand these social consequences. She says, "When our lives have been so devastatingly altered by chronic pain and illness, with not a single facet untouched, the support we receive from friends and family becomes all the more essential. But one of the many ironies of a life with chronic pain is that at the very time you need the love and support of those you care for most, those relationships are so often challenged and affected by the same cause of that need. And so this person here is recognizing that pain is challenging those relationships that she needs most. So the question becomes, well, in what ways does chronic pain challenge the maintenance and formation of social relationships? Because if we can understand why chronic pain challenges social relationships in the ways that it does, then perhaps we can make inroads to developing effective interventions that target social roles relationships that are affected by chronic pain. So I have just a few points to discuss here on a few proposed reasons why chronic pain challenges social relationships. The first is reduction in participation in social activities, impaired interpersonal functioning as a result of chronic pain, loss of social roles and social identity, difficulties connecting with others as a result of chronic pain, stigmatization, compassion fatigue and contagion of suffering. So we'll just talk about those in turn, and then we'll have some time to discuss clinical implications and have some questions. So first is fairly obvious, and that is that chronic pain directly impacts upon participation in social activities. So it physically takes people away from their social networks. Unexpected flare-ups may interfere with social plans. Persistent pain and uncertain timing of flare-ups might be a disincentive to planning and engaging in social activities. It can often prohibit participation in some competitive social activities. Fear of judgment or stigmatization may lead to social withdrawal, and there's some evidence that people with chronic pain are actually less likely to be invited to social events because people don't make assumptions about what others are capable of. Perhaps a less obvious consequence of chronic pain is that it may impair the interpersonal functioning of the person with pain. And I'll just explain this a bit further. So chronic pain induces self-focused attention. As you can imagine, if you are experiencing persistent pain, and pain grabs attention and focuses it on the area that might be under threat. And so if you have persistent lower back pain, you might constantly have your attention drawn away from others and towards your lower back, where the source of pain is. Now, because your attention is taken away from others, this can reduce your ability to show perspective taking and empathy. It can reduce social interest and attentiveness to others. An obvious consequence of pain distracting attention from others is reduced social interest and reduced pro-social behaviour. And it can impinge upon people's ability to self-regulate and self-monitor, because self-regulation, emotion regulation and self-monitoring, these are skills that we use to adapt our behaviour to different social situations, different social contexts, different social expectations and norms. So we might, for example, want to laugh out loud on a bus, but when we're reading a book, but we self-regulate and we might stop ourselves from laughing too loudly. We might be at a work event and we notice that no one is swearing, and so we use self-monitoring to stop ourselves from swearing in that situation. And these skills, self-regulation and self-monitoring, they require attention, they require cognitive capacity, they take up cognitive load. Now, if chronic pain is distracting people's attention, they're going to have less capacities for self-regulation and self-monitoring and might be more likely to show social behaviours that are less appropriate. So that's one possibility. Chronic pain is also associated with a more negative mood, and negative mood is generally not considered, certainly in North American cultures and Western cultures, negative mood is not really considered to be particularly socially appropriate, something that we often try to mask in order to make others feel more comfortable. Negative mood also, it can influence group mood via processes of emotional contagion, and if a group becomes negative in their thinking and their emotions, they tend not to, have a good time, get along and affiliate. So mood can get in the way with affiliation processes in that way. It can also, just being in a negative mood, it can induce more negative judgments and impressions of others. This is a negative evaluative bias that can come just from being in a negative mood. So if it's a very cold, wintry day and you've stubbed your toe on the way to work, you might be less positive in your evaluations of candidates, new colleagues, anything really. There's a huge literature on this. Any subjective judgment can be toned down to become slightly more negative when you're in a negative mood. And so this affects social relationships because obviously people are less positive when they're in a negative mood. Chronic pain can also cause a loss of social roles and identity, and I touched on this with regards to the spousal relationships. This is really quite an important consequence of chronic pain. Social relationships are founded upon shared identities and interdependent social roles. That's something that we all experience as we develop through life. We might have childhood friends who we used to be very close with, we had much in common with, and as we grew up, our lives took us in different directions. We have different life experiences and we may no longer have anything in common with them. We may even have very different, perhaps social or political views, or different social lives, and then relationships may suffer because of those changes or the reduced commonalities. And so this is really an important consequence of chronic pain, to the extent that someone is no longer able to work and they lose their identity that's associated with their job role, to the extent that chronic pain impacts on their ability to ski or do their hobbies, play football, be in teams. That can just erode the commonalities that people have with their friends, which is a major source of relationship closeness. And so at a fundamental level, chronic pain can erode the foundations of relationships. It may also result in difficulties connecting with others for a couple of reasons. Just noted on this slide are two reasons. One is self-stigmatization. And self-stigmatization is common and can lead people with chronic pain to focus on differences between themselves and others rather than similarities. So they actually remove themselves from others rather than others removing themselves from the person with chronic pain. Self-stigmatization is believing stereotypes about, believing in and applying stereotypes about people with chronic pain to the self. So believing that perhaps you're less than, or more lazy, or more unreliable, or less able to do certain things than others because of your chronic pain. There's some research by Michael Nicholas and colleagues has shown that self-stigmatization is actually one of the best predictors of social relationship deterioration. That's fascinating because it's not actually necessarily others that are stigmatizing and rejecting the person with chronic pain. It can be that we bring about that isolation ourselves just by our own self-stigmatization. A fear of being burdening others might lead to self-isolation as well, so kind of in an altruistic sense. And then I haven't noted it on the slide, but I've also recently conducted some research to be published in Pain Reports looking at the automatic non-verbal behaviour of people with who are currently experiencing pain. And what I found was that people who are experiencing pain are less able to affiliate with others non-verbally, so less able to show mimicry, smiling, other sort of non-verbal behaviours that function to connect us with others. There is, of course, a real problem of stigmatisation and the possibility of social rejection. Pain behaviours do have a negative effect on social evaluations, certainly of strangers. This is some research I conducted with some colleagues at UCL in London, where I found that when people who show pain behaviours are evaluated as less kind, less trustworthy, dependable and competent than people who show no pain behaviour. In this particular experiment, we controlled for all appearance characteristics, and that the people who were being evaluated for their traits and characteristics, you couldn't see any of their physical appearance. It was just like a silhouette of the person that was seen by participants, and when the silhouette or the shadow showed pain behaviour, the shadow was evaluated as being less dependable, trustworthy and kind. And so there's a sort of an implicit bias in our evaluations of people who show pain behaviour, and that can lead us to be less likely to perhaps be kind or to form friendships with people who show pain behaviour. Of course, none of that research has not been replicated with when we view people we're already friends with. It was an anonymous figure that was showing pain behaviour, and I think it's important to see whether this is also the case with our friends. In other research, we know that doctors routinely underestimate chronic pain, which is and actually in very recent research published in Pain early in 2016, Amanda Williams and her colleagues showed that people with chronic pain may be perceived as less trustworthy. It's sort of a systematic bias in perception of patients reporting chronic pain, and that may lead doctors to underestimate the pain that's being reported by patients. It is estimated that 1 in 4 chronic pain sufferers is inadequately treated, and this may be due to the systematic bias and perceived trustworthiness of patients with chronic pain. Workers' compensation and health insurance providers often attribute chronic pain complaints to malingering. This is this constant suspicion that people are trying to use the system to get out of work. It's a culture that needs attention and needs to be revised. Compassion fatigue can also be a source of a cause of relationship deterioration. Not only caregivers but also healthcare providers report finding chronic pain care to be frustrating, ungratified and emotionally exhausting. It is understandable given that chronic pain can't necessarily be or can't be cured. It is persistent, it has ups and downs. And it's a lifelong journey, and it can be quite exhausting not only for the person with pain but those around them who are watching that journey and helping them along their journey. The interpersonal consequences of compassion fatigue are fairly detrimental. When someone experiences compassion fatigue, they show efforts to avoid contact with or even conversations about the source of their compassion fatigue. It can lead to a feeling of detachment or estrangement from others, not just the person who might be causing them compassion fatigue, but others in general. So it might, caregivers may also find it not only difficult to connect with their loved one with chronic pain, but to connect with others in general. So it has a generalizing effect. It can cause a restricted range of affect, which means less able to experience high highs or low lows, relationship dissatisfaction and resentment or even hostility towards others, specifically and especially the person who might be the source of compassion fatigue. And so you can imagine if someone has compassion fatigue that would be a risk factor for their relationship and the way that they interact with their partner. This little cartoon here shows a man playing a small violin. It says he's playing air violin. Studies show it reduces compassion fatigue. Contagion of suffering is the final process that I might mention for why relationships could be challenged by chronic pain. And again, this is focusing not on the person with chronic pain, but the person who's living, cohabitating with or supporting the person living with chronic pain. Caregiving a chronic illness can have a negative impact on caregivers' physical and psychological well-being. So it's not only the person living with chronic pain who is experiencing distress, potentially depression, and fatigue, which would in turn affect their interpersonal skills, their ability to connect with others, but it's also the caregiver who's experiencing the suffering, which in turn affects their ability to maintain their relationships. Caregivers often experience similar emotions in response to others' distress, and so if that's the case, then for all the reasons why the moods of people living with chronic pain would undermine their ability to interact with others and get along with others, those would apply also to caregivers who experience similar moods and emotions as the person living with chronic pain. Caregivers can also experience contrasting or reactive emotions in response to their loved one's chronic pain. They might experience anger in response to their anxiety, for example, and anger is not going to facilitate relationship harmony in any way. So this sort of contagion of suffering, you have not only this person living with chronic pain challenged by their suffering in their ability to get along with others, but the suffering is contagious, affects the caregiver, who then also has difficulty interacting and relating with the person who has chronic pain. So just to review, we looked at reduced social participation in social activities, potential causes of impaired interpersonal functioning, loss of social roles and social identity, difficulties connecting with others, stigmatization, compassion fatigue, and contagion of suffering, all as potential reasons or explanations for why chronic pain challenges the maintenance of social relationships. So just briefly, we have a couple of minutes left. Clinical implications of all of these studies and this review. Well, first and foremost, I think it's important, this research indicates strongly that it's important to evaluate patients' social functioning, their satisfaction with social roles, and the health of their interpersonal relationships, not just with their peers and spouse and offspring, but also their work colleagues. Because all of these social relationships, as well as their satisfaction with social roles, are going to be critical in determining the distress, anger and depression that they experience in response to chronic pain. And as you may be aware, most of the management of chronic pain is focused on living a full and meaningful and happy life despite pain. And so really this is critical. If our goal is to improve the well-being of people living with chronic pain, because we can't necessarily cure their chronic pain, but we can help them to live a healthy and happy life, then a critical component of this outcome is their social functioning and their interpersonal relationships. So that's what I would suggest. I think that's where we need to go. That's where we will get better outcomes for people living with chronic pain. That's how we will enhance their well-being. So first we need to evaluate it. We need to do an initial assessment. We need to see if our current treatments for chronic pain, our CBT and multidisciplinary programs for pain self-management, we need to see or know if they're having an impact on social functioning as well. When we teach people give people cognitive behavioural strategies for managing their mood, is that also having a downstream effect on their interpersonal behaviour and their ability to relate to others? the second question is, would the individual patient benefit from a social intervention? Now, there's fairly limited evidence for social interventions, but what evidence there is, the randomised controls that are available show that they have moderate effects. They're good treatment effects, good sized treatment effects. Group CBT for chronic pain may be particularly useful for people looking for developing their social skills or developing relationships with other people, finding support from other people with chronic pain, targeted social integration, perhaps social skills training is in order. And I know that there are, at Duke University, Frank Keefe has led some studies looking at couples training. So training for the partner or spouse or carer of the person living with chronic pain in understanding pain and helping the partner to cope with their partner's chronic pain, so that they can utilize the benefits of that social relationship for managing their pain. So there's much work to be done here. This is just a touching on what might be, what we could do, and it's certainly an area that requires a lot more investigation, effort and investment. So now we have time for questions.
Okay. And to our audience, if you have any questions that came in, please enter them into the question and answer box in your GoToWebinar panel. Some questions that came in. Do you know of any resources we can reference when trying to improve relationships with those suffering from chronic pain?
Resources. Yes, so as I mentioned, Frank Keefe at Duke University has conducted a couple of randomised controlled trials of relationship counselling and relationship support. And I think you'll be able to find those references by just looking at the Duke University website. If you go to Frank Keefe's research page, he will have a list of his citations and research references there. And they're fairly recent, in the last 5 years, 5 to 10 years. He's really there's only really a couple of people in the world doing social interventions, and Frank Keefe is one of them. So that is where I would probably direct you first.
Okay, we can include that, a link to his site on the Duke University in our follow-up items to our audience as well. Another question. Did you come across any specific coping mechanisms when dealing with social relationships affected by chronic pain?
So coping mechanisms for the person living with chronic pain, I'm assuming. Coping mechanisms could be cognitive or behavioural. So it could be empathic understanding, for example, of others, like reinterpreting others' behaviour not as rejection but misunderstanding, or it could be behavioural coping mechanisms. So, for example, using pacing strategies and preparation to get yourself out to see people, making appointments with others, doing activities like getting out and socialising with others, and forcing yourself to socially integrate. So there's behaviourally. The other coping strategy that I have seen is explaining to others that you have some persistent pain that may affect that they may detect, but then to quickly follow it up with a comment that you're able to cope quite well with it and they shouldn't worry about it. So addressing the elephant in the room and saying, you know, you can disregard it. Let's just get on with the relationship. So there are quite a few cognitive behavioural strategies for people that can be generalised or used in the context of social relationships.
Okay. Another question, you mentioned social skills. Is this akin to cognitive behavioral coping skills training? And if so, where can we find resources?
That's a good question. I'm not aware of where you will find resources for this. I don't know. It's something I would have to follow up, I think, and Angie, I would have to perhaps provide you with links to some resources that you can provide to the members and attendees.
Absolutely, yeah, we can take that as a side project when we do the webinar wrap-up. I think that's all the questions we have for now. Do you have anything you'd like to add following your presentation?
No, it's difficult without seeing the faces of my audience, but no, I think that's, if no one else has any further questions, that's it from me.
If any questions we missed in this presentation, I will send to Claire following, and we'll answer the questions in the wrap-up. So thank you so much, Claire, for your presentation.
Thank you.